tonight to this exciting meeting. At least we think it's going to be an exciting meeting. Unfortunately, Ed Hoffman is unable to be with us tonight. He and his wife, Joanne, are vacationing in a quaint village in France. The name of the village is Saint-Genès. And they send their love, and they hope that everything goes well tonight. Of all the things and accomplishments that people concerned about MIC has done, tonight we really miss them because we think that we really do wish that they could have been here to share this with us tonight. I would like to introduce to you Mrs. Mildred Holt and Miss Susan Davis. They were co-chairpersons for the community health survey that we conducted. It is because of their concerns of the health of the community and due to the proximity of our community to the chemical plants that the conception of the health survey began. It was through their tireless efforts that we began to form a committee to gather information on how to conduct the survey. At this time, I'd like to introduce to you Ms. Mildred Holt and Ms. Sue Davis.
I'm Mildred, and there's Sue. We were the ones who worked so very closely with the students last summer. And I believe it's my turn to give you a little background information here. I want to join with Pam in welcoming you this evening to this momentous occasion. You know, we are a volunteer group, and a volunteer group means, in our instance, means that we don't have a real support system to do sophisticated kinds of things. But through our perseverance and through the help of so many people, we have been able, we think, to make an outstanding contribution, which you will hear about. As we promised our three communities, West Dunbar, Institute, and Pinewood, we would not divulge any of this information until we could present it to the communities and the media simultaneously, and that is what we are doing this evening. Beginning July 10 in 1987, a comprehensive health survey was initiated in the three target communities. From the outset, there was keen interest in this attempt. We had a lot of interest that was positive, and we had a lot of detractors who said that we were not going to do anything scientific and that it would be for naught. Well, we didn't feel that way because we just kept right on. Because on tonight, June 7, 1988, we are making a report to you, the public. A little bit about our organization. People Concerned About MIC is a volunteer community group, and we are indeed dedicated to protecting the health and safety of all who live, work, and study in close proximity to chemical plants which give out lethal emissions of toxic fumes. We came into being in 1985 after the Bhopal disaster, and we began to look at our environment in a very critical way, but not until August 1985 did we really go into high gear, because it was on August 11, 1985, that our community was galvanized into action because of a similar leak, similar to Bhopal, happened right here in Institute. And of course the citizens were outraged because we had been promised that nothing like that could happen here. People Concerned then became the prime, I guess the main voice for community concern. We became very much an advocate for an improved quality of life through a cleaner community. We began to do a number of things. We provided information through planned meetings to residents. We planned for, asked for, researched for right-to-know information. about what is stored next door to us, how much is stored, what kinds of chemicals are stored next door to us, how much. We pressed for alternative evacuation routes. We pressed for a full evacuation drill. We have lobbied for reduction and/or elimination of storage of highly toxic chemicals in huge quantities. So you see, our actions go far beyond the name, people concerned about MIC. We take credit for some of the successes that we've had because we think that some of our public pressures have resulted in some changes. As I indicated to you, that it was in February 1987 that we began this effort. Why conduct a survey? While all of us are living in who are living in the Kanawha Valley are concerned about health risks, those of us who were living in close proximity to toxic emissions were the most concerned. And we began to wonder, why hasn't a health survey ever been made of our area? Why hasn't somebody looked at us through all the years when tons of toxic waste were going through our communities? To our knowledge, nobody ever made a survey. Not even, they didn't even evince an interest in our health. So this is why we think what we're doing as a community volunteer group is unusual and unique. After we decided to do this health survey, we had three simple goals. We knew that we couldn't identify causality, but we wanted to identify unusual or recurring health problems in our community. We wanted to develop a health profile which would provide residents, health authorities, and other appropriate governmental officials systematic health information about our residents. We also wanted to demonstrate to governmental officials and anybody else who was interested that we no longer were passive, that we were going to stay very action-oriented, we were going to become involved in positive ways, and we wanted change to occur. We worked on an exceedingly tight timeline. If any of you have ever been involved in conducting any kind of community survey, you'll know that it's a very complex and a very sensitive effort. We had conferences with the directors of the Appalachian Student Health Coalition from the Center of Health Services at Vanderbilt University, and we vacillated. We kept saying, we can't do this, it's too much. But in April 1987, we did make a formal application to Vanderbilt University, and we were approved under a special category. 2 technical assistants came to our community in June to work with us for a full month in all aspects of this, of preparing for this survey. Then 19 more interns who were going to do the actual door-to-door survey arrived July 9th. When that splendid group of young people left us on July 22nd, they had conducted 1,061 interviews. But as we went through this information, we threw out several of them, and only 1,042 were complete. And those were the ones that we used and upon which our data are based. With each interview supplying answers to 100 questions, there were over 150,000 pieces of information that had to be analyzed and compared with other available health statistics. Now, an effort of this magnitude usually requires a lot of money. Money for consulting services, money for housing and meals, money for printing survey forms, flyers, postal fees, and for publishing the report which we have here. And it's at this point that People Concerned wishes to express our profound thanks and appreciation to a number of people who participated in this whole effort. First, we want to thank the residents of Institute, West Dunbar, and Pinewood who participated in the survey. We want to thank those same residents who, along with other residents from the Greater Kanawha Valley, gave many donations and were generous in their hospitality. The interns from Vanderbilt, before they left, they said, don't you ever mention this survey unless you give special thanks to a very special person. And Dr. Angie King, where are you? They said to always acknowledge your wonderful, loving community spirit and your very personal help to them. And we applaud you for that this evening. To our neighbors in the city of Dunbar, who graciously consented to pilot test our survey, we give thanks. Then, to those who journeyed from Nashville, Tennessee, the 2 assistants, technical assistants, and the 19 interns. Those 19 interns trudged through hot and humid July days to gather this information. They, of course, were from the Appalachian Youth Coalition, the Health Center Services of Vanderbilt University. And I think you may be interested in knowing that those 19 people, 21 really, represented 13 states in our nation. And we feel that they represented the best and the brightest of young people who were going out to help change the world. Now, in addition to the many donations, $5, $10, $20, $25, and I believe we had 2 $50 donations, we had 2 angels who really took us over the hump. An anonymous donor from Kentucky gave us $500. And then from our own Charleston, West Virginia, we were just shocked and surprised when a gentleman underwrote the total expenses for our community-wide farewell dinner to the 21 Vanderbilt students. And I believe from 80 to 100 people sat down to dinner on that evening of July 21. I don't want to embarrass him, but I believe he's here in the room. And I'd like for him to stand, and I'd like you to meet Mr. William Drennan, who is president of Cox Morton Corporation. And Mr. Drennan, we thank you, because without you, we could not have shown our hospitality to those young people. There, he's not going to stand, but there he is back there. And our board member, Mr. Bill White, has been instrumental in sharing with Mr. Drennan our needs and our concerns. And together, they've made quite a team in providing a strong support system to people concerned. There was another volunteer by the name of Lois Eisenberg, Dr. Herb Eisenberg of College of Graduate Studies. He's on the staff there, but she heard about us and said, I'll help. And she, practically alone, did the inputting of all the names of the 2 persons who provided the professional validity for our effort. There really are not sufficient words to thank these 2 people. Without them, we could not have had a report. Robert Hall, PhD, a sociologist with a specialization in healthcare, took the leadership in the development of our health forum. He saw to it that it was entered and corrected in the computer program. He then spent countless hours in organizing and interpreting the data. Dr. Hall also is executive director of Common Cause West Virginia, and he teaches sociology at the College of Graduate Studies and at the University of Charleston. Gregory Warner, MD. He's chief of the Division of Occupational and Environmental Health, Department of Family and Community Medicine at Marshall University Medical School. He, of course, is our medical consultant. What did I say, Warner? Yes. I beg your pardon. Dr. Gregory Wagner, as much as I'm, well, a little nervous here, Dr. Wagner. W-A-G-N-E-R. He spent countless hours in working with Dr. Hall and committee members. And I'd like to reiterate that all of the assistance that we received has been voluntary. No one has been paid. People who helped us did so while carrying out their own considerable job responsibilities. For all of those who helped us, please, let's applaud them. Now, you have in your hands a newsletter, and the pullout is the report. There may be some typos in this report, and I think Dr. Hall has several that he's going to bring to your attention. But we want you to know that this has been an extreme effort on our part. You will see some articles in here that are thought-provoking, but it sort of gives an overview of what we are about right now. We hope you will read it with interest, and we'll be appreciative of your comments. And it's at this time that Pam and I are going to move from this area and ask both Dr. Wagner and Dr. Hall to come forward. Dr. Hall is going to give the report, and Dr. Wagner is here to answer questions that you, along with Dr. Hall, that any of you might have. Again, let me express our sincere appreciation for your taking an evening out to come to this meeting.